Imagine being miles from help when someone suffers a cardiac arrest or severe trauma. What you know in that moment could save a life. In today's increasingly remote world, from wilderness adventures to off-grid living and rural healthcare deserts, advanced first aid skills are more crucial than ever. Beyond basic CPR and bandaging, understanding when and how to intervene in serious medical emergencies can bridge the gap between life and death before professional help arrives. When someone collapses and stops breathing, every second counts. The chain of survival begins with immediate recognition of cardiac arrest. Check for responsiveness, call for help if available, and begin high-quality CPR immediately. Compressions should be at least 2 inches deep at 100 to 120 beats per minute. Use the beat of Stayin Alive by the Bee Geos to maintain rhythm. It's scientifically proven to match the optimal compression rate. For life-threatening bleeding, remember the 3Ts, tourniquet, tissue pressure, and triage. A tourniquet applied 2 to 3 inches above the wound can be life-saving when applied correctly. Remember the mnemonic, T-clot, time, compression, look for bleeding, open airway, transport. For chest wounds, seal them with plastic wrap to prevent tension pneumothorax, a condition where air builds up in the chest cavity and collapses the lung. Here's a fascinating question that combines medicine and math. If a person loses blood at a rate of 1 milliliter per second, and their total blood volume is approximately 5 liters, how many minutes would it take to lose 40% of their blood volume? The point where most people start showing serious symptoms of shock. The answer reveals why rapid intervention is critical. 40% of 5 liters is 2 liters. At 1 milliliter per second, that's 2,000 seconds, or approximately 33 minutes. But this is deceptive. Symptoms often appear much sooner due to compensatory mechanisms. The real question is, how can we calculate the golden hour of intervention when considering both volume loss and the body's response time? Isolation and stress in remote environments can trigger mental health crises. The SAMSPA mnemonic helps identify serious mental health emergencies: suicidal thoughts, agitation, memory loss, sudden personality changes, paranoia, and recent trauma. In remote settings, creating psychological safety zones and establishing communication protocols can prevent escalation. These skills aren't just for wilderness guides or healthcare workers. Parents, teachers, community leaders, and even office workers can benefit from understanding these advanced techniques. Many organizations offer certification courses that combine online learning with hands-on practice. Advanced first aid represents the intersection of knowledge, preparation, and human compassion. By understanding these critical interventions, we not only improve individual outcomes but strengthen community resilience. In an era where remote living and off-grid lifestyles are increasingly common, these skills are becoming essential rather than optional. Remember, the best emergency response begins before an emergency happens. Regular training, keeping updated certifications, and maintaining emergency kits can make the difference between tragedy and triumph.